Sit back and listen to the experience of a healthcare provider and fellow diabetic foot pain patients. Qutenza, capsaicin 8% topical system, is indicated in adults for the treatment of neuropathic pain associated with postherpetic neuralgia, PHN, and for neuropathic pain associated with diabetic peripheral neuropathy, DPN of the feet. Important safety information. Treatment with Qutenza must be performed only by a healthcare provider. Never apply or remove Qutenza yourself. Do not touch Qutenza or items exposed to capsaicin. Touching Qutenza and then accidentally touching other areas of your body can cause severe irritation of eyes, mucous membranes, respiratory tract, and skin. Please see important safety information at the end of this video.
I've been a diabetic since October of 2000. I went and had a routine test and it came back that I had type 2 diabetes. Then I noticed that I was having pain in my feet. The initial pain felt like I was being stung by bees.
I can relate to that. Mine is like somebody with a blowtorch, or I'm standing on hot coals, constantly burning. I've put up with this for 20 years.
You're a tough guy. You dealt with that for 20 years. I couldn't deal with it for 7 months.
You get to that point that you'll just do anything for relief. I would go in and sit down, take my shoes and socks off.
For me, it made me feel less. I felt like my family and everything was going forward, and I was just stuck. I couldn't go and participate with them on things that they were going out to do. They would tell me about it, and I'm missing out on these things. But how did it feel for you, Roger?
For me, 20 years of it, but now I can look back and say things are a lot different.
I tried larger shoes. I wear a size 13. My son brought me a size 16, thinking that that would help. When other people are trying to help you with your issue.
Yeah. They referred me to this pain management clinic that I go to now, and the nurse practitioner, she asked me about this product, Qutenza. I'd never heard of it. I said I'd give it a try. Now, you've had more treatments than I have. How long did it take before you started feeling your relief?
Again, I was skeptical too, but I had the first treatment. I think after the second treatment, I felt something. I wasn't sure. For me, it wasn't until my third treatment that I felt some type of relief. And then the more treatments that I had, the more relief I felt. I wasn't thinking about my feet every day. It was that third treatment for me that did the trick. What about you?
I felt just very little about 3 days after my first treatment. And it wasn't much, but a little bit is hope. When I did the second treatment, I had less burning and I just started to get some of that feeling back. With the Qutenza treatments, the pain's going away, and for me, it's 3 treatments made it a lot better. I walk now, and it's like I don't even think about my feet. They're just there. You don't have it on your mind constantly.
My favorite thing is I'm not locked into one pair of tennis shoes. Every event, Christmas, birthdays, my children would give me tennis shoes. They were piling up in the boxes because I wasn't wearing them because my feet hurt.
I'm doing things that I didn't realize I didn't do before because I slowly gave it up. And I'm looking forward to the next treatment.
My name is Adrienne Clemens. I'm a nurse practitioner at a large hospital. We treat hundreds of patients with diabetic peripheral neuropathy of the feet. Oftentimes patients come to me already on oral medications. They are very excited to hear that there is another option. I decided to give Qutenza a try because my patients were very frustrated. Qutenza offers a unique opportunity to help these patients address DPN pain without having to undergo more invasive treatments or adding to their pill burden. We currently have about 60 patients on Qutenza. Diabetic peripheral neuropathy of the feet is a chronic, lifelong condition. It's a chronic disease. It took a long time to get there. It may take 3 to 4 treatments before you see substantial results, and ongoing treatments are important to keep those symptoms at bay.
My wife and I, we've been married 3 years now. I will soon be 78 years old. And we enjoy being able to get out and do things. With pain in the feet, if you've never had it, you'll never understand it. It's miserable. I always wondered how anything could be so numb and still hurt so bad and burn so much. You try to ignore it, but it's hard to ignore it when it gets that bad. And there was times I'd just have to quit whatever I was doing, take my shoes and socks off. I just couldn't walk as much, and I had to really start being picky about shoes with inserts. I went on for years. I just figured there was no hope, live with it. Before treatments, at night, there was times I couldn't have the blankets on my feet because the blankets would just cause it to burn even more. And it'd make it hard to fall asleep when you're in that much pain. I started going to a pain clinic with a nurse practitioner who really seemed to understand pain. And she told me about Cutenza.
Cutenza could help many patients as there is a clear unmet need in this patient population. Once I talk to a patient about Cutenza and they have agreed that it's something they're committed to trying, I always review potential side effects with Cutenza administration and let my patients know that the most common side effects seen in clinical studies were related to the application and included a burning sensation, redness, and itching at the application site. And some patients reported pain in their foot. Some patients might feel pain or burning during the application or feel like they have a mild sunburn for a few days afterward. Cooling packs can be used to help during that time. I remind the patient that this is not a prescription that they can bring home and apply themselves. It must be applied in my office by me or another qualified healthcare professional. I know you drive an hour and a half to get here. What makes you keep coming back?
It's worth the drive to get here. I was skeptic. I wasn't going to do it. But you explained it to me how I didn't have to come every week or every month. I wasn't taking pills. It was just you would do a foot wrap, basically. People were getting relief from it. And I trusted you because you helped me with so many other things.
Roger, I know you're very active. What are some of the things that diabetic nerve pain at the feet kept you from doing?
I've had it for over 20 years. And slowly it just got to where I wasn't doing things. I'd give it up without even realizing I wasn't doing them. First treatment didn't help me a lot. The first couple of days after, I didn't think it was any good. And then I started, after a few more days, noticing just a little bit of relief. And when you're in that much pain and burn that long, a little bit of relief means a lot. And I thought, well, if one treatment helped, let's try the second one.
After how many applications did you start feeling relief in your feet?
I came back for my second treatment, and it started working a little faster. And after the second treatment, they would schedule me. When it gets down close to that 3 months, I'm ready to go.
Every patient's situation is different. We spend the time to reiterate the clinical benefits of Cutenza. We also remind them that treatment with Cutenza is just 4 times each year. It's not a monthly prescription.
I decided that I would go for the third treatment, and I would go 4th, 5th, and whatever. I'll probably continue this till as long as I live, probably.
When your appointment is finished, remember to schedule your next application of Cutenza. Please see important safety information at the end of this video. Indication: Cutenza, capsaicin 8% topical system, is indicated in adults for the treatment of neuropathic pain associated with post-herpetic neuralgia, PHN, and for neuropathic pain associated with diabetic peripheral neuropathy, DPN of the feet. Important safety information: treatment with Cutenza must be performed only by a healthcare provider. Never apply or remove Cutenza yourself. Do not touch Cutenza or items exposed to capsaicin. Touching Cutenza and then accidentally touching other areas of your body can cause severe irritation of eyes, mucous membranes, respiratory tract, and skin. Do not touch your eyes or other unintended target areas during the Qutenza application. Qutenza is not for use near eyes or mucous membranes. Do not sniff or inhale near Qutenza, as this may cause you to cough or sneeze. If irritation of eyes or airways occurs, or any side effects become severe, notify your doctor immediately. You may experience substantial pain during the treatment. Tell your healthcare provider if you're experiencing pain. A cool compress or medicine for the pain can be provided to help lessen your discomfort. You may get frostbite if you cool your skin too much. You can use a cooling pack from the refrigerator, not the freezer, and avoid putting it directly on skin. Qutenza can cause serious side effects, including pain, severe burns, and increases in blood pressure during or right after treatment. Your healthcare provider should check your blood pressure during treatment with Qutenza. If you have high blood pressure that is not well controlled by medicine, or have had recent heart problems, stroke, or other vascular problems, you may be at increased risk and should discuss with your doctor whether Qutenza is right for you. Seek medical attention if you experience strong and continuous pain or skin lesions, such as blisters after treatment. Tell your doctor if you have reduced sensation in the feet. You may notice that you have less feeling for hot or sharp pain where Qutenza was applied, but this is usually minor and temporary. Treated areas may be sensitive to heat, for example, hot water, direct sunlight, vigorous exercise, for a few days after treatment. The most common side effects of Qutenza are redness, pain, or itching where Qutenza was applied. You should tell your doctor if any side effects bother you or do not go away. To report suspected adverse reactions, contact Veritas Pharma Incorporated at 1-877-900-6479, option 1, or FDA at 1-800-FDA-1088, or www.fda.gov/medwatch. For more information, ask your healthcare provider or pharmacist. Please see full prescribing information provided by your healthcare provider or at qutenza.com.